you'll hear from Dr. Kristine Coons, who is a transgender intersex female physician practicing in Spokane, Washington. I follow her on Facebook because I get so much interesting and accurate medical and scientific information that often is not part of this equation and should be. She practices as a hospitalist in internal medicine and has been practicing since 2024 at the local Providence Hospitals. She graduated from Midwestern University in Phoenix and completed her residency training at Grandview Medical Center in Dayton, Ohio. Kristine served her mission in Phoenix, Arizona, and shortly after returning home, married her wife, Laura, after writing each other faithfully for several years. They have 4 children. Dr. Coons has spent considerable time and effort understanding and researching genetics, variations of sexual development, physiology, human and sexual development, along with her medical practice. And she's presented in various forums and lecture settings. Her story has been featured on Lift and Love, Listen, Learn, and Love, and Beyond the Shadow of Doubt.
Hi, I'm Dr. Kristine Coons, and I decided to wear scrubs today because I wanted you to actually see me as my patients saw me. I'm a physician in Spokane, Washington. I work as an internal medicine physician, as a hospitalist, which means that if you ever get admitted to the hospital, you're going to see me. And this is probably how you're going to see me. I get confused for a nurse all the time, and I'm totally fine with that. I love the nurses that I work with. I love the team that I get to be a part of. So you all are going to be my patients today. And what I'm going to do, I'm looking at the clock, by the way. They told me to look at the clock. Is kneel down a little bit. Because this is what I do with my patients. They're there in a hospital bed. They're concerned. They're worried. They have a illness, they have an infection, some of them have cancer, and it's a scary experience to them. As I walk into a room and meet them for the first time, they see me, I see them. And I have to open up this encounter with are you going to trust me? Am I worthy of being trusted as a doctor that's just meeting you for the very first time? That's a scary experience. Being transgender, being intersex, and walking into a space that you have no idea what you are going to experience or see. My patients come from all walks of life. They come from the good, they come from the bad, they come from everywhere in between. I have to work with drug users, those who abuse alcohol, and are going through seizures or alcohol withdrawal or other experiences that are just scary to them. Sometimes they don't even know why they're there. And I get to share with them why they're there. Now, one of the things that I experience a lot is infections. So when a person comes into the hospital with infection, or another word we use is sepsis, I have to take that infection and I have to work with it. First, I have to diagnose this infection. Where is it coming from? Why is it there? What type of infection, what type of bacteria am I contending with? And I choose for my tools a selection of antibiotics. And I choose that antibiotic specifically for that individual, for that circumstance. Now that's an acute illness. They're there for pneumonia or cellulitis or urinary tract infection. What about other experiences? Have I taken care of transgender individuals? Yes. Intersex individuals? Yes. Gay individuals? Yes. One of my earlier experiences in my practice, I was working in the ICU. And it was a scary experience because this gay couple had come in. They had no idea what was going on, but one of them was in a coma in the ICU on a ventilator. And I went and talked to their significant other and reassured them that they were going to do just fine. They were showing evidence of recovery and that illness that they were experiencing was going to go away. I met them in the hallway about 10, 15 minutes later, and I got the biggest hug that I can ever remember. They needed that. So when I walk down the hallway, I am known for giving high fives and fist bumps. I'm known for being very sneaky. My wife can attest to that. She's nodding her head over there. She is over there. I sneak into rooms and I surprise people a lot because I'm very quiet. You would never know that just by looking at me. So what I do is not just as a hospitalist. My role as a doctor, as a person, is to provide healing. And that comes in various forms. So one of the things I want to share with you is hope. I work with a lot of different people from across the country and even a little bit internationally. There is a lot of people that are fighting for you, that are supporting you. You may not see them and you may feel alone, but I can tell you, as your doctor, that you are not alone. There are people looking out for you and want the best for you, regardless of the circumstances that we run into, whether it be politically, religiously, or anywhere in between. This is silly that I use these quotes. I love cartoons. Can you believe it? I love cartoons. I told you it was silly. Two of my favorite quotes, and one of them is actually not from a cartoon, comes from Frozen. Do the next right thing. And I have to ask myself a lot of times, what is that right thing? Because sometimes I don't know in the moment. I have to think about it. I have to ponder on it. I have to pray about it. The other one that I also love is from the movie Cinderella. Be kind and have courage. Sometimes all we need is just that extra measure of kindness to reach out and love somebody. And sometimes it's just a matter of being brave. And being brave is not the absence of fears, but it's still doing the right thing in the face of that fear. So thank you so much for your time. And I hope to see you all later.